Hi everyone, greetings from Northwest Gainesville. My name is Dr. Robert Leeman. I'm an associate professor and the Mary F. Lane Endowed Professor in the Department of Health Education and Behavior and the College of Health and Human Performance here at UF. So my research concerns addictive behaviors, and there are some concerns about triggers for problems with addiction that folks are particularly concerned about now with COVID-19, so I'm here just to share a few thoughts about that with you. So one factor that people at first may think of as trite is boredom, but actually patients frequently report that boredom is an elicitor of slips and relapse with substances. So it's important for these individuals and frankly for all of us to try to stay as occupied as we can during these times. We also know from years and years of research that stress, of course, elicits problems with substances. And while it's natural that we want to stay informed and up on the news, and we're concerned about the health and welfare of our friends and family, probably limiting the amount of news access we take in now is probably advisable and help us modulate that stress. So while access to treatment is a challenge these days, there's been some recent positive developments on this front. So the Drug Enforcement Administration, or the DEA, has just relaxed regulations regarding buprenorphine, which is a life-saving treatment for opioid use disorder. It's also known as Suboxone. So now prescribing physicians can begin treatment with buprenorphine for individuals with opioid issues, even if they've never met with them in person, just based on a phone or video consultation. So that's a really positive development in helping to get this important treatment out there to the folks who need it. It's also important now to keep in mind that there are really useful tools available on the web. So one really great example is a site called Rethinking Drinking. And to get to this, all you have to do is Google Rethinking Drinking. It's the first thing that comes up on Google. So this is a site developed by the National Institute on Alcohol Abuse and Alcoholism. And the nice thing about Rethinking Drinking is not only does it have facts about alcohol, it has a series of questions that one can answer to get some feedback about whether or not a person may have issues with alcohol and may want to scale back their drinking. So it's really nice in that way. But no doubt, access to not only formal interventions and treatment, but just support is a challenge now. So don't be afraid to reach out to individuals who you know who might have had issues with addiction or other mental health issues. Reach out to them however you might, by phone, text, video chat, to say hello and stay connected. You don't necessarily have to talk to them about issues with addiction or mental health, but it's good to remain connected. Will be good for them and probably good for you as well. Last message I have for you is I don't want to see people get stressed out about their routine. If their normal routine has to do or includes having a beer from time to time or a glass of wine, if that's something you normally do, don't stress out about that. It's important to keep those routines. And it's not necessarily the case because you've been having a beer or a glass of wine from time to time that you have a problem with substances. Again, keeping our routines as intact to the extent that we can is something that can help keep us sane, help keep our mental health where we want it to be. So stay happy and healthy, everyone. If you have any questions about anything here, or you think I might be of any help to you with regard to questions about addictions, feel free to be in contact with me. My email address is my first name.lastname at ufl.edu. So robert.leeman, Leeman, @ufl.edu. Take care.